My name is Sarah Kelleher, pronoun she, her. I am a licensed clinical social worker. I have been a therapist for about 5 years. I specialize in sexuality and relationships. For many years prior, I worked in an HIV and hepatitis C clinic, an infectious disease clinic, for about 3 years. I have a major passion for harm reduction, and I just really love talking about harm reduction and the ways that we can be safer in our choices. And yeah, so let's get started. Okay. So yes. So what we'll cover today is an overview of the concept of harm reduction, techniques for how to incorporate harm reduction into your life and your substance use. And then at the end, I have a living document, which everyone has access to share resources. So principles of harm reduction. This is from the Harm Reduction Coalition, which is an organization in the United States. It's a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. It's also a movement for social justice built on a belief and respect for the rights of people who use drugs. Harm reduction acknowledges that many people will use drugs and engage in behaviors, and that many people are unable or unwilling to access help or like what is considered proper treatment in the United States. And it's helpful to be aware of the ways that we can reduce harm that is not focused entirely on abstinence, which has been the model of recovery in the United States. I'm going to primarily be speaking from a United States lens because that's where I live and that's the harm reduction practices that I am most familiar with. So there is no universally agreed upon definition of harm reduction. The term harm reduction became known to the broader public, I would say, in the 1980s, although harm reduction practices have been being utilized way before that in many different ways. And it became known to the broader public primarily through activists. And who were opposed to the dominant criminal and medical models for addressing drug use. So the two most important forces promoting harm reduction in the United States have been activists and scientific research. Activists have included historically LGBTQ community, sex workers, people that use drugs, people from marginalized communities who were left behind in medical approaches to drug use. And the movement of harm reduction cannot be divorced from the activists that have created this model and also have worked diligently to encourage science to catch up with the real world, in that, you know, activists were the reason that scientists and scientific research actually started to look at harm reduction practices and how they help, because people were not taking it seriously. And so sex workers, people that use drugs, marginalized identities, the LGBTQ community, it cannot be divorced from harm reduction, because these people are the people that have made harm reduction available to the broader public. So this is just a quick little history of some of the roots and movements in the United States that were emerging throughout the years, and how the current harm reduction movement and principles have foundations in a lot of these roots. So Yes. Okay, so before we get into strategies, I want to go over a couple of myths about harm reduction that are really prevalent. So the first one is that people are against harm reduction because they believe that more people will start doing it being drugs or engaging in risky behavior, and that harm reduction enables and promotes risk-taking behaviors. So there are many people that claim that, distribution of safe supply or needle exchanges or giving out condoms, which are three major examples, right? Reduces the negative consequences, the perceived negative consequences of drug use, leading to riskier behavior and more or drug use patterns, right? So it's okay, like, use drugs. There have been countless studies that have focused on this exact concept, and there is no statistical evidence that harm reduction increases risk-taking behaviors. There is no research that backs this concept. Harm reduction services are known to significantly decrease incidence of overdose, sepsis, STIs, HIV, and hepatitis C. And in fact, people who access harm reduction services are more likely to access treatment services. I saw a number yesterday from somebody that a person who accesses a clean needle is 500% more likely to seek treatment. That sounds outrageous. It was from a doctor that works in this field. That's an incredible number. So I've seen numbers that are double, triple, quadruple times like this. People that have access and know about harm reduction are much more likely to seek longer term treatment. No one can say that they live a risk-free life, right? And people engage in behaviors that have risks all the time. It is a part of life. And that happens for a multitude of factors. So when people are more informed about the risks, they are better equipped to prepare, and this leads to safer behavior. So another myth is that harm reduction is costly to the public health system. So there is a ton of research, again, backing that harm reduction is a cost-effective intervention. The criminalization of drug use and the drug war and the costs of treating preventable harms related to use costs billions of dollars each year. And harm reduction initiatives such as supervised consumptions, ESM callouts, such as supervised consumptions and distribution of safer supplies reduce EMS callouts and ER department visit rates. I don't have the number, but it is proven that they reduce visits to the ER. And yeah. So there's an estimated that the average cost of a needle syringe program is between $23 and $71 per person per year. That's the cost. A research study showed that cities with syringe access programs showed a 5.8 decrease in HIV prevalence, which is estimated to save between $3,324 and $7,000 per case of HIV that was prevented. So again, so many studies have disproved that these are not cost-effective programs and mechanisms that people are engaging in. Myth 3, harm reduction creates public disorder. Many people talk about how harm reduction practices increase crime. Like, this is what you hear about when people are like, don't want certain things in their backyard, like not in my backyard type of people. Research has shown harm reduction initiatives decrease public injection drug use and publicly discarded needles. And again, I'm focusing a lot at this moment on syringe exchange programs and clean needle distribution, because that was historically where a lot of the research has been condensed at the time that I built, at the time of the research that this was done. So a lot of the initial harm reduction efforts were surrounding, where research was done was surrounding HIV and injection drug use. So a lot of the studies at this time were about the needle exchange programs and syringe access. So studies have shown that supervised consumption services do not create the honeypot effect. And the honeypot effect, when applied to substance use, proposes that people who use drugs may be attracted to areas where safe consumption sites are. And the fear is that there will be an uptick in crime. So not only is that not true, it's been proven that there is not an uptick in crime when access to harm reduction tools and interventions are available. And also, it's a very stigmatized lens of that people who use drugs are going to cause crime. And it's just, it's disproven. It's not a real thing. A lot of multitude of factors go into why crime happens. So evaluators of a Vancouver safe consumption site examined official recorded crime rates as markers for a honeypot effect and noted no significant increases in drug trafficking or assaults and robberies in the year following opening of the site. Instead, they noted a decline in vehicle break-ins and thefts. So additional studies have also found similar correlations. So a lot of people also think that harm reduction doesn't apply to them. And that harm reduction is just needle exchanges, just distribution of condoms and Narcan or naloxone. Harm reduction is a set of practical strategies and services and a philosophy that can be applied in all care settings. So it's meeting people where they are at, it's including yourself, and harm reduction strategies reflect specific individual and community needs. So there is no one universal definition, because harm reduction practices must take into account the specific community needs that a plan is being addressed for. Everyone has different needs. And so a harm reduction approach requires that we understand those specific needs so that we can actually have a correct approach. So harm reduction is a way of establishing relationships and rebuilding trust, and it fosters connection. And harm reduction is throughout our lives. It is seatbelts, sunscreen, life jackets, vitamins, mental health care, it's policy, it's everything. And so even if you are a person that does not use drugs or doesn't use the drugs that a lot of initial harm reduction efforts were put at, it still applies to you. There's always a way that we can lessen the harm. Okay. So for the first part, I'm going to talk about medications that are available to manage substance use, to manage withdrawal symptoms, to cut back use. I'm going to look at kind of the pharmacological approach available at this time. So for opioids, there are two main ones, methadone, buprenorphine, and naltrexone. So the issue is that access in the United States, certain doctors are only allowed to prescribe certain, Suboxone. You have to be on a specific list to be able to prescribe Suboxone. There are limitations. When COVID happened, Many people that were on methadone who were going to pick up their daily dose were unable to. And there had to be so much navigation that happened, because people were not people that needed the methadone, but the clinics and the healthcare system was not prepared to meet people's needs. So people could not go and pick up their daily dose. So there are a lot of restrictions, especially in the United States, with access. And these medications do exist, but the difficulty is surrounding hospital policy, drug policy, access policy. For alcohol, there are a couple like listed here. There's a lot of medications that have come out that either make you sick when you drink alcohol, or help you to decrease cravings for alcohol. I won't say a lot, but there are a few off-label use of antidepressants. If you have a mental health condition, you will probably not be prescribed antidepressants for a reduction in alcohol use, because it won't work as well for you. So there's limitations with that. And these are options. And again, this is not to say that this is the way to go by any means, but it's important for people to know their options and that these medications exist. Because again, an issue is that many doctors also are not aware that these medications exist, and also are resistant to prescribing them because, again, the healthcare system promotes this abstinence-based model and treats people that use drugs from a very stigmatized lens. So methamphetamine and stimulants. There are currently no FDA-approved medications to treat methamphetamine use disorder. And that's an issue. Appropriate doses of benzodiazepines or antipsychotic medications are available if a person is experiencing delusions, paranoia, anxiety, hallucinations as a result of their use. But again, there's access issues. A person needs to have a doctor that they trust or a care team that is willing to provide these medications, to prescribe these medications to this person. And again, people that use drugs are very stigmatized. So some doctors are not willing. Because you cannot technically die from certain withdrawal from certain drugs, that there is an idea of just power through, and that's not acceptable. These cravings are incredible, and they're really difficult to just manage on your own. It's not really a realistic suggestion. And so a lot of times with stimulant use, sometimes doctors will use, or healthcare teams will prescribe, antidepressant that has similar properties to amphetamines. Bupropion is one that is becoming more popular. Again, the effects will not be the same, and they'll vary from person to person. So again, any medication stuff that I reference is really important to have a trusted healthcare team that you can go over this with. I can't speak to the specifics of these medications. So nicotine, there are currently 7 in the United States. Maybe that's an outdated number, but there was 7 at the time of this, that are approved by the FDA that can help manage nicotine cravings. Patches, gum, sprays, lozenge, oral inhalers. And with nicotine medications, you can often combine medicines, longer-term medication management, with patches and short-acting medication. So like a lozenge and a gum can be combined with a longer-term medication or the patch. Dosing is extremely important, because if you're not getting the correct dose initially, it's going to be a lot more difficult. So psychedelic and dissociative drugs, benzos, inhalants, there are no FDA-approved medications that help manage the withdrawal symptoms of some of these drugs. So again, having and finding a clinic and a healthcare team that you can speak openly and honest about about your use, and they can help address some of the symptoms that you may be experiencing if you're trying to cut down, could be really helpful. And having a person that has, a psychiatric or medical background that can speak to the interactions of these medications with each other is going to be key if you want to take a medication approach. So GHB, to soothe symptoms, benzodiazepines can be prescribed, but again, they need to be prescribed. So just a note about medications in general. So when it comes to PrEP, PEP, HIV medications, there is no contraindication with substances that, with drugs. So the recommendation is, a lot of people are scared of them interacting. And the studies, again, there's not that much research, but the studies that have been done on drugs with pharmaceutical drugs such as PrEP, PEP, and HIV medications, antiretroviral therapy, there is no issue. So a lot of people will take their medication with their first hit of the day, with their first drink of the day. Some people take it in the morning and then delay use until later in the day, but they work just as effectively. Again, this is a conversation with your doctor. But at the clinic that I used to work at, where we, did HIV care and PrEP and PEP care, that was our recommendation, was that you can take your medications. Nothing is going to happen. It is better to take the meds than to not. That is not the same advice necessarily for some SSRIs and mental health medications, but for those medications, antiretroviral therapy and for PrEP and PEP, people had developed all sorts of ways to remember to take their medications, and there was no contraindications for taking them. So that's just a reminder. When it does come to, again, this is for very specific medications, but usually the suggestion is spread it out. So take your medication in the morning and then delay use for as long as possible, or engaging with substances for as long as possible to spread out the effects. Again, this is a conversation with your doctor or care team, but for HIV meds, PrEP and PEP, you're good to go. So now I'm going to go behavioral approaches. These are just all like a list of all of them. But so in the United States, there are, needle exchange programs, there's opioid treatment programs, there are safe consumption sites where the first one was opened in New York City. You can go and there is medical staff there, and you can use safely. You are provided with equipment, you are provided with education, there is resources there if you want them. They exist. So there's also a lot of support groups that do not require or promote abstinence. You have to go looking for them, but they do exist. A lot of people have resistance towards doing a support group because historically many of them have promoted and valued abstinence. And there are people that do not want that, and they should not be punished or looked down upon for not wanting that. Harm reduction is all about doing tiny things to help yourself live a better, safer life. And so if there are groups that do not promote abstinence, they exist. HAMS is one for alcohol, but there are many that promote harm reduction and not abstinence. So these are, there's designated driver programs. There are giving car keys to someone before you start drinking. Eating before drinking or eating a full meal before using is helpful. Staying hydrated, taking vitamins to replace anything that may have been lost during use, right? Or before use, helping your body to feel as good as possible before using. having an accountability system, going out with a friend who can monitor your behavior and consumption, or who you tell them, hey, I want to get, I'm going to do this. Can you be there and make sure everything is okay? And many people are open to that. Of course, this needs to be like a non-judgmental, a non-judgmental, compassionate, supportive friend. But as much as possible, it's important to not use alone. Another thing to be noted in this presentation is that the drug supply is constantly changing. It's constantly changing. And again, these suggestions will not apply to every single drug, every single person that uses drugs, every single combination of drugs that somebody uses. It is for me, choose what you like and what makes sense for you and leave the rest, because these are just the options, right? Because a lot of the drug supply is different now than it used to be 5, 10, 15, 25 years ago. And suggestions need to change, right? Some of the suggestions that initially were really helpful no longer apply for the type of drug supply that we're seeing. So again, some of these will not apply anymore or don't apply to you, and that is totally okay. Bringing condoms when you go out drinking, scheduling at least one abstinence day a week, right? So let's say you use every day, all day. Maybe that means you don't use for 2 hours on one particular day. Maybe that means you don't use for one day, right? If you use 30 days out of a month, maybe you don't use for one day and you choose that day and that's the day, right? Or maybe you cut down your use on that one particular day. Can look any way that you want it to look. And that is the important thing to remember. So some people like reducing the number of days you drink or use per month. Some people look at a calendar and track their use and choose a day, choose a week, choose 2 days, choose any amount, choose a couple of hours, any amount that works for them. So there are safer injecting and smoking supplies, and accurate information on how to use them available. A lot of organizations distribute these supplies and you can order them now and they will send them to you. They are really great. They're listed in the end. Behavioral approaches are also referrals to treatment, right? And that doesn't just mean substance use treatment. That means mental health care. That means getting a primary care doctor to address, some of the other bodily things happening, right? Going to a dentist, getting proper referrals that you need to improve your overall health. So education about and tools for proper hygiene. So toothbrushes and toothpaste, a lot of stimulant users can experience teeth problems. And so being aware of that, right? How to deal with that. There's resources in the back that have specific dental hygiene care that are listed all in the back of this presentation. So trying to stay hydrated as much as possible. And eating even tiny bits before use, right? A little bit of food is better than no food at all. Not only for your experience, but also just overall feeling good. Distribution of condoms and lubricant. So using lube. If you don't use condoms, using as much lube as you can and more lube is helpful to ease friction. Discussion about body image and the fear of gaining weight if you stop using. People use stimulants as a form of weight control. And so speaking to a therapist, mental health provider, doctor, anybody about your specific reasonings, right? Or fears surrounding cutting down your use, if that's something that you're choosing to do or trying to use more safely, right? there are many reasons and many factors for why people use drugs. And so having a team or understanding that people use substances for all sorts of reasons and addressing that and bringing that out into the open and talking about it, having a safe place to just share about that is really helpful. Avoid using alone. So there are hotlines, there are people that a friend you can call, stay on the phone with you. There are having a friend with you, having a group of people. There are ways, avoid using alone if possible, because there's a risk of, if something goes wrong, that you'll be alone. Tester shots. So a small, tiny amount, not only testing your drugs before consumption, but also doing a small shot, a tiny, tiny, tiny amount to see and make sure that everything is okay before maybe engaging in a higher dose. So keeping any of your works and tools to yourself, right? So pipes, pipe covers, straws, label them, have a little baggie for yourself. This is difficult sometimes because it can be, people want to share, but you can have your own, and also you can suggest where people can get their own works if they would like to. That can be a boundary that you have with yourself and with other people. So avoiding mixing substances, especially ones that build. So drugs like MDMA, their effects go up over time. And so sometimes people will be like, I'm not feeling it, and take more and mix substances to enhance the effect. You want to make sure that you know the drugs that you are taking, like their lifespan. And so make sure that you're not adding before feeling the full effects. Mixing as little as possible substances can be safer. So again, staying hydrated, but being careful not to drink too much, because this is related to a lot of MDMA and ecstasy. It can, overconsumption of water in a short period of time can happen. So there are a ton of test kits, drug checking databases to determine the purity of drugs, right? Googling, that's also in the resource page. Googling what a pill is supposed to look like, what a drug is supposed to look like. You can type in and a picture will come up of like exactly what drug you have gotten. So safety plan when going on dates, letting people know, letting a friend, somebody, anybody know where you are, what you're doing, and who you're with. If you're going to be using drugs, if you're going to be using substances, like let someone know so that you have a plan. Hey, if I don't text you at this time, can you check in? Hey, can you, I'm going to share my location, or I'm going to do these things where somebody knows that if I don't reach out, to contact me. There's also lock boxes that have timers, that have codes, that sometimes people like to put their drugs in to spread out their use. So that is something that is available as well. There are home testing kits for viral hepatitis, STIs. There are organizations, I heard of one the other day that sends it to you for free, depending on your location. And so a lot of people, drug testing, STI testing can be expensive depending on where you are and what insurance you have. And so there are organizations that will send you testing kits. So reducing your frequency of use, right? Like I was saying, there's many options for trying to cut back if that's what you want to do. That could be one less bag a day, one less puff. That can literally be any decrease in your use is significant. So, change up your mode of consumption. So if you inject, maybe you want to alternate to smoking every couple of uses or once in a while or full time, right? Maybe you want to boof, right? Again, the high will be different, but if you know about it, it can be helpful. Like smoking can be an alternative method of consumption for people. Minimizing lip contact with other users to avoid infection. So again, not sharing things, keeping lip balm on, any more moisture, the better, to help avoid infections. Ritualize is a personal one, meaning that it won't apply for everybody. But maybe if you're trying to cut back on use, right, you want to make the time that you use special, right? So maybe you go a little bit slower, or you set a space for yourself to use. You kind of make it special and ritualize things about it so that it can help to cut down maybe on chaoticness use, or like chaotic use. But again, that's a really particular one that may or may not apply for some people. Some people get activated or triggered by the ritualization of their drug use. Other people, it really works for them. So investigate your environment and make it comfortable. So the setting, right, can help the experience of using drugs be better. We'll talk about that later, but setting yourself up for success, right? So taking a minute, setting your space up, setting yourself up for a positive experience. Delay. So delay by 1 minute, couple of hours, any sort of delay, right? So when we get an initial feeling to want to use, try to delay it, right? For as short or as long as you want. If you are feeling like I'm not high enough and I want to get more high, delay it a little bit. See, like give yourself some time. You can set timers, you can clock it in other ways, like related to timers, but there are a lot of ways to just spread out and delay use. So maybe, trying not to drink when certain things are happening, or when certain people are home, or at a certain time, like playing with those things for yourself and seeing if there's a decrease. So having an overdose or overamp safety plan. So again, talking with someone that maybe you use with, or is a friend of yours, or a safe person, about, hey, if something happens, like this is what I want you to do, or this is what I don't want you to do, or this is what you can do. Like knowing what are helpful things to do in those moments if someone has taken too much and is possibly overdosing. So in the back, there's also resources of like, here's what to do. If EMT needs to get involved, or, emergency services, when you call them, say that somebody is not breathing. You don't initially want to say, hey, I think someone's overdosing, because again, there might be some stigma, and we don't want anything to delay the care. So call them and say, hey, this person stopped breathing. And then once they get there, you can potentially say you can say something, but hey, this person's not breathing, please send help. They should be carrying medications on them that could be of use without saying that. So these are just more. So portable oxygen tanks are also really helpful. You can order them. I think some organizations provide them. I'm not positive, but if someone has taken too much, a lot of times they need help with breathing. So these little portable oxygen tanks can be really, really helpful to have. Take care or cover cuts, scrapes, and open wounds. So anything that has blood or is more is sensitive, you want to cover up, because that can potentially lead to infection. Again, lip balm often. Again, if you're with clients or friends you don't know, or people you don't know, bring and use your own drugs. Like I said, the supply changes drastically, constantly. And so if you're in an area that is not your home area, the drugs could be different. Or if you are with people that you don't trust, or you don't know if they've tested their drugs, like either bring testing strips on, and also use your supply of drugs. If this maybe is with clients, or if this could be in any situation, try to use your own and bring your own. You don't need to share. This is your, just for safety, because you don't necessarily know where someone is getting their supply from. And also it might work for them, but it may not work for you. Use a buddy system, try to track your use if possible. Those are options for people if they're trying to cut back. Cleaning anything you use, understand and know the proper cleaning. Know the drug policies and laws in your area. So for in New York, we have something called the Good Samaritan Law, where you can call, and even if you are engaging in drug use, you cannot get in trouble. But again, there are restrictions. So if you're carrying a certain amount of weight, if you have a felony, if you have if you have a warrant out for your arrest, like they call it the 3 W's. So warrant, weight, and I'll come back to that in a minute. But so know the policies in your state, because again, they're so different. Condoms in places are even considered paraphernalia. So be aware of that if that's something that's important to know. So when you buy and you sell your text or your tell, so this is sort of a little quote of reminder that people that use drugs sometimes also sell drugs to support their use, or also their lifestyle in some capacity. And so be aware that if you are ever involved in law enforcement, that they will look at your texts, and that you don't want to send any of those messages that could be used against you. And just be aware of that. Sleep, safer sleep. So people recommend sleeping in certain ways. Like I've heard back is best for some substances. Obviously trying to prioritize sleep after particular use, or a lot of use, can be really helpful. And again, these are just some suggestions, right? So using your imagination, these are only 1% maybe of suggestions that are out there. There is so much available, and really it's about what will work for you. Finding ways that can help you and reduce, or not even reduce use, but reduce the harm that that chaotic use can cause at times. Finding what works for you and forget the rest. There is always a way to do something safer. So understanding the risk set and setting. So it's the concept that nothing happens in a vacuum, and that it gives people more tools to support the risk and use harm reduction in certain moments. So I think initially this was applied to like psychedelics to help people have better trips, but you want to think about like the risk itself, right? Like what you're discussing. So what is this person saying about what they need, right? Or what issue is happening, right? And then what other possible sources of harm might be connected to the main issue, right? So there's a multitude of factors why someone uses drugs. So can we help to address other areas in their life, right? Or in our lives too, of how to help us engage more safely. Look at the drugs being used in your life. So like, what are the risks of overdose? What are the risks associated with the particular drugs that I use, right? How can I make this safer? How can I get education on them? How can I learn more about them? These specifics of these type of drugs and the policies surrounding them, and the harm reduction practices related to these drugs. A lot of there was one on here of go slow and low. That doesn't apply for all drugs. It really doesn't. So there are some drugs where the substance really matters, and the advice that you want to take is really dependent on the substance at hand, right? So consider what drug is being used and apply your harm reduction practices to that particular drug. So the set is referred to the mindset that somebody brings to the situation, including mood and expectations, right? So how are we feeling? Are we physically in pain? Do we need to get well? Like, can they engage with you fully? This is more for like providers, but in general, think about this you can think about this for your own drug use as well. Like what mindset am I in right now? Am I setting myself up for success? Am I in an environment with the setting that is not going to be good for me? Can I go somewhere else and do this? And can I make myself more comfortable? So checking in with self of like, what's my mindset right now? What am I feeling? Am I at risk for using more than I usually would because I'm upset, angry, hurt, disappointed? Check in with self. Setting. So the physical and social environment, and the perception of how that can promote or reduce risk, right? So the setting can be activating. It can be triggering. Like, are we at a club with friends? Are we with people that we don't know? What is the setting? What type of environment are we in? That can really affect use. So that's something to be aware of and check in about as well. So just general reminders. I mean, there's so many that we could talk about, but harm reduction is about changes, about tiny, tiny, small changes, and try not to get overwhelmed with long-term changes, right? Feeling shameful or bad or not recognizing the ways that we are choosing to engage safer only makes us feel worse, right? Any sort of change that we make that helps us live better lives is a win. And being really gentle and non-judgmental with yourself is absolutely crucial, right? Like this is not serving you at all to beat yourself up about why this is happening, or if use has gotten chaotic, or even if you want to manage your substance use in a different way than you have been, even if you don't have a problem, or your use is not chaotic, or you actually don't really see a problem, but you just want to be safer. Like, be gentle and non-judgmental with yourself, and know that these things take time and experimentation to find the things that work for us. You know yourself better than anybody. So, again, these are suggestions that I have heard and not come up with, but I have heard and people have used, but you know yourself and you know your use and you know your life better than anyone else. And so the ways that you want to shift and experiment, trust in that and the ways that work for you. And so, especially with navigating healthcare and maybe trying to get care, right? There are people that will put their agendas on you and be like, no, you should stop entirely, or no, this is what we should be working on. Anybody with that type of energy is not someone that is prioritizing what you're saying. And harm reduction in its foundations and its principles are listening to the people that are what they're saying, are the experiences of drug users, are the experience of the people that, harm reduction was made for. And so keep that in mind. You know yourself better than anyone. And so stand firm in that. Community and connection. There are also people who exist and who want to be connected and who use substances and have no interest in cutting down their use, and also care about their health and their lives and themselves. And they exist, and it's important to find and connect with people that support you and your choices. Connection is the opposite of addiction. This is something that you'll hear a lot, in that the way we treat substance use in the United States is we take the cutoff mode. We cut people off, we punish them, we stigmatize them, and it cuts people off. And there's of course someone's going to use more. I mean, that's really upsetting. And so finding ways to connect with community and with people that, again, lift you up and are non-judgmental and are gentle and compassionate and supportive and care about you, they exist and they are here. And it's really helpful to have support around you. Oh, I guess it's not showing up, but oh yeah, okay. So this is a document that I made. This is in no way an exhaustive list. It is open for anyone to contribute to. So if you click on the link, you can have access to it, but there's, again, these are all from the United States. But there's websites, there's supplies on here, there's organizations that have just general harm reduction information. There's documents about safe for hormone injection, maintaining boundaries in drug use. There's infection. There's so many resources on here and little like documents and pamphlets. So again, you can add to this list, you can share to this list. Hopefully this is a living document that will go on. And this is not exhaustive. There are so many organizations and people doing incredible work on the ground. And yeah, so I think I covered everything. Oh, here's my information. I am a therapist working and living in New York City. And I have, that's, the Psych in the City BK is my like email. And then Sarah Kelleher is my personal email. But I share drug body sexuality information. And also if you are at this presentation and you can feel free to email me if I didn't provide resources for you in your area where you're living. I am always happy to connect people or research for people, orgs and things that they're looking for. I know it's really difficult sometimes to ask for assistance and it can be really overwhelming with all the information that's out there. But I am always happy to provide resources. If I don't know of resources, I will ask my network and my community. And so feel free to email me and saying, hey, do you know any harm reduction organizations in this area or in this town or what about this? Like, I am happy to help with that. So yeah, that's it. I think you can also email me and ask me questions, or if you want to talk about the presentation, I'm also here for that. So feel free to reach out. But thank you so much for coming. And I hope this was informative and helpful. And yeah. Okay, everyone. Well, thank you so much for attending. And I hope this was helpful. So bye.